external defibrillator is available on the back wall of the legislative chambers. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. We will begin with the agenda for the Douglas County Board of Equalization. Roll call, please.
Commissioner Boyle?
Here.
Commissioner Kavanaugh?
Here.
Commissioner Friend?
Here.
Commissioner Morgan?
Here.
Commissioner Rogers is absent, but Chris Rogers is present virtually. And Madam Chair.
Present. Item A, approval of the minutes of the Board of Equalization meeting held Tuesday, September 21st, 2021. Item B, call for a meeting and set Tuesday, October 5th, 2021 as a date for hearing on certified assessment corrections reflecting the addition of omitted property to the tax rolls or increased value on property. Is there a motion to approve A and B?
Second.
Motion by Commissioner Boyle and seconded by Commissioner Friend. Roll call. Or please vote, sorry. Going back to my old habit.
Motion passes 5-0.
Citizen comments. Is there anyone here wishing to speak to the Board of Equalization about an item not on the agenda? Seeing none, we will move to resolutions, items D, E, F, and G. Is there a motion to approve?
So moved.
Motion by Commissioner Morgan, seconded by Commissioner Friend. Any questions or comments? Those on Zoom, could you please mute? Please vote.
Motion passes 5-0.
We have one protest, a protest of personal property penalty and interest for Stevens and Smith Construction Company, Inc. Good morning, Mr. Goodwillie.
Good morning, Commissioners. Mike Goodwillie, Douglas County Assessor, Register of Deeds Office. This is a pretty standard personal property penalty protest. This personal property return was not filed until August. The filing deadline is May. Those penalties are mandatory from a statutory standpoint, and the ability to protest them and get relief from the board is limited to if the penalty was incorrectly applied or wrongly calculated. On the face of the protest, this taxpayer alleges neither.
Okay.
Their rationale is that their CPA quit, so they missed the deadline.
Are they present in the audience today?
I don't know. They aren't here on Zoom, and nobody seems to be coming up.
No? Right.
As an editorial aside, the number one rationale we get for people filing late is that their bookkeeper quit or their CPA left
Right.
them.
Okay. What's the will of the board?
We would have to make a motion to dismiss the
To
protest.
dismiss or deny, yep.
Make the motion to dismiss and deny.
Okay. Is there a second? Does that include adjournment?
Yes.
Okay. Any questions or comments?
Madam Chair, I apologize. Who made the second on that?
Oh, Commissioner Friend. No, Commissioner Boyle.
Thank you.
All right, please vote.
Motion passes 5-0.
We'll move to the agenda for the Douglas County Board of Commissioners. Roll call, please.
Commissioner Boyle? Commissioner Kavanaugh? Commissioner Friend?
Here.
Commissioner Morgan? Chris Rogers is present virtually but cannot act as Commissioner Rogers. And Madam Chair.
Present. Item A, approval of the minutes of the Board of Commissioners meeting held Tuesday, September 21st, 2021. There's also minutes of the pre-board meeting available from Monday, September 20th, 2021. And item B, approval of claims submitted for payment process through Tuesday, September 28th, 2021. Is there a motion to approve A and B?
So moved.
Motion by Commissioner Morgan, seconded by Commissioner Boyle. Any questions or comments? Please vote.
Motion passes 5-0.
Next is the consent agenda, items A through K. Is there a motion to approve consent?
Second.
Motion by Commissioner Boyle, seconded by Commissioner Friend. Teresa?
If we could take K, excuse me, I apologize, Teresa, your County Attorney's Office, if we could take K on separately, that would be great. I want to provide a little explanation if I may.
Okay. Any other questions or comments? Please vote.
Motion passes 5-0.
We will now go back to consent agenda item K. Teresa?
Teresa, York County Attorney's Office. So this is this is an agreement that this board considered last week. There's a correction to attachment A, and the supporting documentation, you'll note in the resolution, it cites to an exhibit A and B. I'm not sure that you have those in front of you, but they have been provided to the clerk and they will be uploaded to the website later. But again, this agreement is the same as last week. Our purposes in this agreement today are twofold: to make the correction to attachment A, and then also to comply with the Emergency Management Act, which allows this board and counties to enter into contracts without complying with all the bidding requirements. And so that's the purpose of today's resolution. And so when the new agreement is executed by Eric Carlson, pursuant to the Emergency Management Act, we'll supersede and replace last week's agreement. But I simply wanted to explain to the board, agreements are the same. We're complying with county purchasing via the Emergency Management Act, and we are making a correction to attachment A. And I'll take any questions if needed.
Okay. Is there a motion to approve item K? Motion by Commissioner Boyle, seconded by Commissioner Morgan. Any questions or comments? Commissioner Kavanaugh?
Thank you. And thanks for that clarification. In light of that, and just so the public is aware of what we're doing here, could you outline briefly what we're doing in attachment K?
Teresa, York County Attorney's Office, sure. So letter K is a staffing agreement for the Douglas County Health Center. We do have a nursing shortage. This board has declared an emergency with regards to the pandemic. The pandemic has exacerbated that nursing shortage. We would, so we're entering into this staffing agreement so that the health center will have an additional pool of nurses that they can pull from.
So these would be nurses in addition to the nurses that we have on staff,
Hopefully, yes.
kind of temp type people.
It's a staffing, yes, it's a staffing agreement.
Right. And it's because of COVID.
You know, I would say that COVID has certainly exacerbated, I think, for many folks, the hiring situation. I wouldn't necessarily say it's 100% attributed to COVID, but I do believe that COVID is in play, and that is part of that is the reason why we're doing it as an emergency, is this board's declaration related to COVID.
Thank you. Just so folks know, does this actually, because I don't see it on here, contain a dollar amount?
I think that you have, as part of your packet, the updated and corrected attachment A, which provides rates. But I cannot answer whether you have a cap on it for a total dollar amount. But I believe attachment A has your rates. So if you didn't hire anyone from the staffing agency, there would be no cost. But the rates are available in attachment A.
Right. Right. In attachment A, is that right?
Right.
Yes, and I believe that's in your packet.
Yeah, okay. So we wouldn't know until the number of temps were actually retained, what the cost would be, is that right?
And I would defer to the health center, but I believe that is accurate. And I don't know if they have someone online or not, or present.
If I may, on our monthly meetings, a lot of times there's discussion about the use of staffing agencies for staff. This would just fall under, it's just another contract with another staffing agency to get people hired when in need.
And I think that, you know, it comes into play in terms of the funding if we're, you know, paying for this out of regular general funds type
Right.
funds, or if, because of its COVID relation, we might be able to get some COVID relief assistance to pay for this. That was kind of where I was going with that. Do we
And if,
know?
and if I may, I would defer to the health center. They would know the finances there better than I. I would be more the legal side of it, so.
Okay. I don't know. Joe, would you have a view on that?
The ARPA law says that if the people are substantially dedicated to dealing with the pandemic, it would be a qualifying expense. And I don't know the specific assignments these people would get, so I can't say exactly if this would qualify or not, but that's the criteria.
And that's something we'd be looking at?
Yes.
Okay, I think that's important because not just in our health center, but kind of system-wide, really nationwide, there's been a real impact of COVID on healthcare providers. And the burnout rates and the turnover rates are increasing everywhere. And so I think that, watching that closely allows us to probably make a pretty good case that at least some of this should be COVID-related expenses. So, thank you.
Okay, any other questions or comments? There was a motion and a second. Please vote.
Motion passes 5-0.
Next, we'll move to recognition and proclamations. We have one recognition of the following county employee who has retired. Jean Denaglo worked for the Douglas County Health Center for 18 years. I understand they are not present today, so is there a motion to approve?
So moved.
Motion by Commissioner Morgan, second by Commissioner Boyle. We wish Jean well on her retirement and thank her for her service to Douglas County. Please vote.
Motion passes 5-0.
Next is a resolution proclaiming September 15th, 2021 to October 15th, 2021 as National Hispanic Heritage Month in Douglas County. And I'll read the resolution real quick. Whereas National Hispanic Heritage Month celebrates histories, cultures, and contributions of American citizens whose ancestors came from Spain, Mexico, and the Caribbean and Central and South America. And whereas the Douglas County is home to many whose ancestry represents the Spanish-speaking nations, and they have significantly contributed to the prosperity and culture of our community. And whereas this national observance started in 1968 as Hispanic Heritage Week under President Lyndon Johnson, and was expanded by President Ronald Reagan in 1988 to cover a 30-day period from September 15th to October 15th. And whereas September 15th is significant because it is the anniversary of independence of Latin American countries, Costa Rica, El Salvador, Guatemala, Honduras, and Nicaragua, in addition to Mexico and Chile celebrate their Independence Days on September 16th and September 18th, respectively. Whereas it is appropriate to increase Hispanic culture, awareness, and diversity by recognizing the contributions made and the important presence of Hispanic and Latino Americans in the United States and celebrate their heritage and culture. Now therefore be it resolved by this Board of County Commissioners, Douglas County, Nebraska, that this board hereby proclaims September 15th, 2021 to October 15th, 2021 as Hispanic Heritage Month in Douglas County, dated this 28th day of September, 2021. Is there a motion to approve?
Second.
Motion by Commissioner Boyle, seconded by Commissioner Friend. Any questions or comments? Please vote.
Motion passes 5-0.
Next are citizen comments. Is there anyone in the chamber wishing to speak or on Zoom wishing to speak to the Board of Commissioners about an item not on the agenda?
Good morning again.
Morning.
Larry Storr, 5015 Lafayette Avenue, Omaha 68132. Another chapter in my series on the Open Meetings Act and possible violations by this and other bodies. I have some evidence which has been presented to you before on June 14th, 2021, regarding Mr. Luis Jimenez, who actually has been a reporter, a source of community information. a while back with the organization called Codex Omaha. And I want to read just a short item about that. But he does sit in his chambers, at least used to, and take pictures of you and go back and try to interview people. But the way he reads his articles, he sort of implies, well, maybe he interviewed you guys before the meetings. Let me read this. During the committee portion of the agenda, the commissioners will take a look at a resolution allocating $2 million out of the general fund for metro area continuum of care. That's only one item. The way he wrote those articles implies that he indeed did interview you people. Maybe he didn't. Maybe he was just reading the agenda when it first came out. But he writes down there that my name is Luis Jimenez, Legislative Chambers, as if that came out of the legislative chambers. I don't think that's proper. He's never been called on that, particularly when it comes to the microphone. He does not admit that he is or was either a reporter and or an outlet by the county board or city council. City council is mentioned in that article too. That's from the Codex website. There was a number of things I presented as evidence. I don't know whether those are actually going to the record or not, but this one on the 14th of this year, July 14th, has many references to him as being a reporter. So that is a violation, simple violation of the Open Meetings Act, the intent and the spirit of. Every person that speaks up here is supposed to identify who he's connected to. That is sort of your responsibility to find out, particularly when it's been pointed out to you a few times. And he's been allowed to refer to me, so I now refer to him. Thank you.
Thank you. Anyone else wishing to speak to the board about an item not on the agenda? All right. We will move to our presentation, our COVID-19 update and COVID-19 vaccination plan update from Dr. Lindsay Hughes. Good morning.
There you go. And you can minimize this or put it up here wherever.
Yeah, wherever. Okay. We'll get through it. Good morning, Madam Chair and Commissioners.
Good morning.
I have good news for you this week.
Yay.
Although we're still in our high transmission, so I'm sorry that it's not better news. However, I can tell you that our 7-day total number of cases here in Douglas County per 100,000 has dropped down to 177.3. which is the lowest that we've been in quite a while. So we're very, very happy to see that. At this point, we really are pretty comfortable saying that we're plateaued, and it looks cautiously optimistic that we are decreasing in our rates now. So of course, we'll continue to watch that. But we're quite happy to see that, you know, whereas a week ago we were we were over 200. This week we've dropped pretty significantly, and so hoping that that buys a bit of breathing room for our partners in the community. All right, you can see the drop here on this cases by age group. You can actually see that that last bar there is shorter than the one before, and you can kind of see that the trend is moving, hopefully in a downward trend. So it's kind of a relief there. So you can see, looking at, typically we're looking at, we've been talking about kids a lot, so looking at that green and below, this segment of the population has shrunk in terms of cases, so that's great news. That is borne out with our school data, so our K through 12 cases over this past week dropped to 2.6 per thousand. The previous week, actually, I think right after I had commissioners, we had a new report and it was like 3.2. So we've had a nice drop over the past week, so that's great news. We continue to see cases, of course. We continue to work closely with the schools to hopefully stop transmission. It's certainly still happening, but we're seeing fewer cases there, at least this week. So that's good news. And then we do continue to see cases in the really 20 to 29 and 30 to 39 age groups is where we're seeing really quite a few of those cases outside of that pediatric age group that we typically are concerned with. And then I'm going to move these guys over so we can take a look at this weekly map and see what that's looking like this week. All right, so you can kind of see here that has the decrease that has happened with cases. It's kind of getting lighter in color than it has been in previous weeks. So for reference, this is what it looked like the week of 9/11 through 9/18. You can see we had some high transmission pockets there. This past week, it's a little more diffuse and fewer cases. So, of course, we're still seeing those cases that are just kind of throughout the community, but fewer of those high number pockets. So that is wonderful, wonderful news. We also have good news on the hospitalization front, although we're still sitting somewhat high. So here, the jagged line that we look at, this is the occupancy rate for our hospitals. As of yesterday afternoon at about 5 p.m., the region was sitting at about 84% for our occupancy rate. It had been up around 89%, so we've come down just a little bit there. Keeping in mind that's a snapshot, so hospital occupancy rate can change very, very quickly. Our adult ICU rate was at 81%, so that's this one over here, and you can see that big drop there. So that's good news. Again, it's a snapshot, so certainly that can change, multiple times over the course of a day. And then for our pediatric ICU, we actually have gone up to 91%. Right now we have 6 pediatric cases that are confirmed, and we have 4 suspected. What the rest of those cases are, I'm not quite sure. I haven't had the opportunity to investigate that fully since we just got that number yesterday late afternoon. We know RSV is still in the community, but we know that is also decreasing. It's possible it could just be a spike of RSV. I'm not altogether sure. I can certainly find that out. And then our ventilator usage has kind of stayed steady up in the 30s, so we're still at about 35 and 36%, or 35 or 36 ventilators in use specific for COVID for that. So right now, our hospitals certainly are still strained. I don't want to minimize that by any means. But hopefully as our numbers decrease, and hopefully they will continue to decrease, we will buy them that breathing room that they so desperately need. I also wanted to talk to you just a bit about breakthrough cases. So breakthrough cases are sitting at 1% right now. So I'm going to move this little screen over again. So 3,299 of all of the fully vaccinated people in our community have gone on to develop COVID and have a positive test. So that comes out to about 1%. And if you'll remember, I have reported on this for a few weeks now, and you're probably thinking, well, the first time you reported this, it was like 0.77, and then it was 0.88, and now you're saying it's 1%. So keep in mind, we're updating this data every week. And of course, as we have more breakthroughs that occur, this data will change a little bit. Why are we having more breakthroughs? Well, keep in mind, boosters were literally just authorized this week. And so we do have that segment of the population that we are seeing breakthroughs in. So those people who are high risk, People who are over 65 who, their immunity does not necessarily hold on as well. So they're potentially at, higher risk to be developing or to catch and develop COVID illness severe enough that we would detect it. People who have compromised immune systems, things like that. And so as we see waning immunity happen with those high-risk populations, it's normal that you would see that breakthrough rate increase. I would say as we get boosters into people, we will see that breakthrough percentage start to go back down. So we'll just have to keep our eye on that. There's also some information over here on breakthrough infections that you can read up on in a short video if you are interested in that. So I just wanted to point out that we had changed a couple things on the dashboard for you to review if you would like. And since we're talking about vaccinations, let's see where we're sitting there. So right now, our over 12 population, so those who are currently eligible for the vaccine, 72.9 have at least one dose. Of all of our Douglas County residents, 60.3 have one dose. Our Black population continues to lag there. We seem to increase at about 0.1 or 0.2% a week. So we're continuing to get there, but very slowly. So that's something that we still want to continue to focus on. For our fully vaccinated, 68.3% of our eligible population and 56.5% of all of our residents. And again, I just want to point out that our Black population is continuing to lag there. For our 12 to 17-year-olds, so those are our adolescents who are most newly eligible. You can kind of see on this graph that, we had a pretty good spike back in May when they were initially authorized for that age group, and we've kind of fallen off, although we do continue to go to middle and high schools to offer that. And what that comes out to is 62.4% with at least one dose and 55.7% that are fully vaccinated. What this looks like really hasn't changed too much when you map it out, and I apologize for having to move that map around on you. So you can see the Elkhorn, Bennington corridor there still is our area with the highest rate of vaccinations in terms of being fully vaccinated. That horizontal corridor that we have, and then our furthest north and southeast areas in Omaha continue to be the areas that we need to work the hardest to continue to get our vaccination rates up. And I think that is all I have in terms of data for you this morning. I want to let you know that we are working on getting boosters out this week still. So as you are well aware, boosters were authorized earlier, later last week. And we have a couple of steps we have to go through at the health department in order to do that. So we need to get a standing order from a physician before we can go out into the community to give vaccines. And so we're working on that process. The CDC hasn't actually put out the template for a standing order, so we use our own to kind of speed things up a little bit. We're working with our medical consultant, Dr. Neiman. She's getting that signed. We're planning to get that out as soon as possible, probably in the next day or two. So that should be available for those high-risk populations, basically those who are over 65 and fit into some other groups based on risk factors. And so other than that, we're still waiting to hear on the pediatric vaccines. Haven't heard yet that the FDA is looking at that paperwork from Pfizer just yet. Hopefully they've done it and we just haven't heard about it in terms of sending that paperwork over. We're still hearing late October. I'll give you more information certainly as we have it, but we just don't know on that yet. So I'm happy to take any questions that you have today.
Thank you, Dr. Hughes. Commissioner Kavanaugh?
Thank you, and thanks for this. Looking at the positivity rate graph here, do you have an actual percentage on the positivity rate, I think?
Are you looking at this initial page?
Sorry?
Is this the page you're looking at, on the summary page? Okay.
You have slightly different information than we get here.
Okay, so it depends on which slide you're looking, or which one of these graphs you're looking at. So if you're looking at people over people method, you're looking at around 19% positivity. If you're looking at test over test method, you're looking at about 7 to 8%. And really it's just, there are two different methods. One allows for multiple tests for a single person to be done. The other is really looking at the percent of actual tests that come back positive. So you could, theoretically have a person who's positive and tests multiple times and tests positive, or tests multiple times and tests negative. So that's not as accurate. We tend to look at the test over test method as a little bit more accurate in terms of how many of the pool of actual tests that you're getting come back positive.
Okay, so if I'm going in and I'm getting tested like once a week, I end up in that first graph that's 19%, right? But the actual, of the population, we think X percent is positive. That would be the second graph would be more accurate. Is that what you're saying?
Well, regardless of how many times you test, the test is going to end up in the pool. It just depends on how you're looking at it. If you're looking at it from the people or the tests being positive.
Okay, so to be clear, if you had to say the positivity rate in Douglas County is X, which number would you pick?
Typically, the test over test is what we would report, and that's what most of the health departments.
And that number is again?
It's between 7. It's 7.5, 7.7.
Okay, so under 10%.
Yes.
Okay. The positivity rate on the map page in the 68104, 68107 zip codes, which are in kind of North Omaha, Benson, and South Omaha, are the highest on the page that we have. Yeah, that's it.
Is this the one you're looking at? Is that what you're looking at?
And you indicated that there's I think you said a minority lag in both vaccination and I guess on the flip side of that positivity. Is that correct?
Well, let's take a look.
It looked like that on the
I think you're right.
vaccination page.
So they tend to, we tend to have fewer tests in those areas, I believe. I'm trying to find where it actually has the, you can tell where I spend most of my time, huh? So one thing that I want to point out to you though on that maps is that everything but that weekly map is cumulative. So this is not for necessarily like a week. Just keeping that in mind, that this is a cumulative test. But I'm trying to find, so I know for vaccinations, absolutely you are correct.
You have a positive test by ZIP, which shows 68104 and 68107 leading.
1 minute.
And then we'll probably come back to this.
And
then you have the vaccination rate, which I think is the one that you have there, which shows kind of an overlap between some of the high positivity test sites and the high vaccination rate sites. I just find that kind of, I don't know, curious. You got high levels of vaccination, but you got high levels of positivity as well. But there is a pronounced ethnic lag in these numbers, right? Among our African American and Hispanic.
We are behind in vaccinating, absolutely, and need to improve access to testing, access to testing.
You mentioned, I believe, the booster availability coming on, and that's something that I think everybody is interested in.
Yes.
So they're available now for people over 65.
They are.
Pre-existing and occupational.
Time.
We'll come back.
Sure.
Commissioner Boyle?
So just to
piggyback on what Commissioner Kavanaugh was saying. As far as the booster goes, from what I understand, it just has to do with those who've had the Pfizer vaccine. Is that right?
Absolutely correct.
Okay. Do you know if you've heard anything or read anything that says that if you've had Moderna, that you can flip over and take Pfizer for your booster?
The current recommendation is not to do that. However, I have also heard that Moderna is planning to submit paperwork for EUA for a booster as well. We just don't know when that timeline is. So I have heard that that's coming. Now, J&J, I haven't heard really much in terms of whether they're submitting paperwork for EUA for a second dose for them. But for Moderna, which I would say many, many people have, I have heard that they are planning to submit paperwork for that. But in terms of mixing doses, right now there is not a recommendation to do that.
Good. And then just to go back to when you talked about how we're having more breakthrough COVID cases, another thing just to point out is that, this virus mutates too. And so that's another reason why people who have been vaccinated are saying, well, I've been vaccinated, why did I get this? And it's very frustrating. But I think we have to understand this. We're on Delta, and it's only going to go down the rest of the Greek alphabet as this mutates. So we have to have patience, the technology to turn on a dime and change the vaccine to suit the variant is not, the vaccine mutates so much, or I'm sorry, the virus mutates so quickly we just can't keep up. So
Yep, great point.
and then also the governor, of course, said that the state dashboard, once we reach below 80% hospitalization rate, he's going to take that away.
Yes.
Have you found the state dashboard helpful for your data collection?
Absolutely. It's helpful for us to see what's happening in the rest of the state, especially because we already have a visual that we're using. So it's helpful for us to have that dashboard and not have to kind of go to our counterparts individually and try to mine data from many counties. It's very helpful to have a snapshot right there for us to look at. And I've heard from many other people in the community and across the state as well that is such a helpful tool to have. So we have also heard that dashboard will come down once hospitalizations drop below 80% across the state. But I hope that might be reconsidered. I know we've talked to the state about how useful that tool really is to so many people. So I don't know whether that'll be reconsidered or not, but we're asking.
Yeah, I think it's a complete disservice to the citizens of the state of Nebraska to take that down. It's not good for the health of the community, and I think that the governor and the medical director for the state are absolutely wrong in stating that. So just to state my personal and public opinion. And then the fourth thing is that thank goodness we're seeing a drop in the numbers of cases. Any theories as to what's working?
Well, of course, as we slowly get people vaccinated, of course that's helpful. I credit a lot of different things. I think that the fact that we have people who are working hard to continue to contact trace and try to draw those lines around clusters and outbreaks and try to keep them from transmitting too much further. We're continuing to do a lot of education with the public. It also could just be the natural trend. So I think this is not uncommon to what we've maybe seen in other places, to have kind of had this spike that didn't go quite as high as what we saw back in November, December, that kind of did this little sawtooth act that we saw while it plateaued, and then is maybe starting to come back down. I think that might be what we saw in the UK. And so it could just be that this is also partly, the natural progression of what the pandemic happens to be doing. That doesn't minimize our need to protect life and health. So of course we're going to continue recommending that people get their vaccinations, wear masks in public, practice social distancing, be outside, try to open windows to get some airflow, sanitizing, all of those things that we know help. We're not done doing those things. So we're still up there. There's nothing saying we can't still go up in those trends. So we don't want to minimize that it's still here, it's still happening. Just because we've plateaued and maybe started to drop a little doesn't mean that our guard can come down.
Thanks.
Yeah.
Thank you. Commissioner Kavanaugh?
Thank you. I agree with Commissioner Boyle's view regarding the state keeping the dashboard up. It's good that we are no longer the embarrassment of the country by being the only place that didn't post statistics. When you go into the nation's map, Nebraska has been a blank spot in the middle of the country because we didn't think it was important to post statistics during the pandemic, and now we are. So that's a good thing, and hopefully that will be continued. Because knowledge is power, and when we're dealing with the pandemic, science and knowledge are really what are going to get us out of this. So I couldn't agree more with the sentiments of Dr. Boyle. The question of the booster and its availability goes to, does the booster enhance your ability to not have a breakthrough case, to stave off the breakthrough case?
It does. So it basically is doing exactly what it's named to do. So it's boosting your immune system. Now, I'm not saying if you get a booster, you're never going to get COVID. There are still people who, even with a booster, may not perfectly process a vaccine, right? But it's going to do a much better job. It basically is telling your body, hey, we need to create lots more antibodies and have those antibodies stick around lots longer in order to fight this off. So it definitely is going to decrease the risk of having a breakthrough case. And a lot of those breakthrough cases are extremely mild. Yes, there are some who have had a small handful who have had severe illness, and those by and large have been people who are in those older age groups or have had a lot of other underlying conditions. This booster is going to especially help those people who already are in those high-risk groups from having those severe outcomes. But those who anybody who would have, had a higher risk of catching COVID, it's going to decrease that.
So it would be a really smart thing if you're eligible for a booster to go out and get a booster today, right?
Absolutely. If you're eligible for a booster, go get it.
Okay. On our vaccination site here, do we have a separate one, or will we have a separate one that shows, in addition to total doses administered, which are the basic initial vaccination, boosters administered, or are they included in this graph?
I think we will. Right now, third doses, I think, are included in there, if I remember correctly. And it just has to do with how the coding within the registry and the tracking systems are set up. So I know that people are working on that. So there should be a way to parse all of that out and display that separately. We're just not quite there yet.
Okay. So we're coming up on, reported 785 deaths due to COVID in Douglas County. And I think nationally we're coming up on 700,000 deaths due to COVID, surpassing any pandemic that's ever been in the past. And, the most severe cases, as you pointed out, are in the ICUs, and this ventilator question comes up. So I think you said that we have 35 or 36 individuals on ventilators currently. What's our ventilator capacity?
So in the metro area, we have 444 ventilators, and 129 of them are currently in use. 36 of those are for COVID. So currently our ventilator capacity is okay. My understanding is we haven't approached draining that capacity yet. But one thing to keep in mind is that other areas surrounding us probably do not have the ventilator capacity that we do. So looking at kind of a broad picture of what's happening if you have other areas that are running out of ventilators, we might need to share at some point.
That's great. We've all read the media about cases from particularly the rural areas of Nebraska finding a shortage of beds or ventilators or whatever. Are they coming to Omaha? Do we find cases from outstate or in the region coming to Omaha?
At times we do. Right now, when our capacity is so stretched, that's minimal. I mean, I think when we are able to help, we do, but by and large, transfers are very difficult right now.
time.
Thanks a lot.
No other, those on Zoom, could you please mute? Thank you. Anyway, those are the questions or comments at this time, Dr. Hughes. Thank you very much for being here, and thank you for the update.
Thank you.
With that, we will move to committees. The first is the budget report as presented, unless anyone has any questions or comments on that specific report. Next, we have a couple of resolutions, a few resolutions for ARPA funds. The first one is a resolution approving the payment out of the county's ARPA funds to the Omaha Douglas Building Commission for COVID-19 related cleaning of county offices and departments in the amount of $41,433.20. This did go through the ARPA committee and was vetted through Deloitte and are put on this agenda for approval. Is there a motion to approve?
Second.
Motion by Commissioner Morgan, seconded by Commissioner Friend. Any questions or comments? Please vote.
Motion passes 5-0.
Next is a resolution allocating $2.5 million of ARPA funds for each commissioner's district so that each commissioner can identify and request spending priorities for those funds within their districts in the amount of $17.5 million. Again, this has been vetted through the ARPA committee and gone through, it will go through the same process as any other of our funds through the committee and Deloitte and then back to the board for approval. Commissioner Maureen Boyle, did you have any comments you'd like to make? That was your agenda item?
Yes, so I presented this because I know that we've made a commitment using ARPA funds for mental health. At the same time, I know that there are other needs out there, and I felt like the mental health project is so big, and it's going to be a while before we really can implement several pieces, that we should do something else to kind of have a quicker and immediate impact on the community. So for that reason, I was trying to think of a way that each commissioner seems to have some ideas about what can help his or her district. So I was thinking if we can appropriate some of the funding from ARPA, since we're getting $55 million this year and $55 million in next year, for each commissioner to kind of investigate what the needs are in their community, and then work even with other commissioners to see if there is overlap, if there's a way we can actually collaborate and use funds more directly into the community instead of waiting for the mental health projects to happen, waiting for making the county budget whole again, and then seeing what we have left over. So I saw this as kind of a proactive way to get some of the ARPA money out there. Now, it still has to go through our ARPA committee to make sure that it meets all the qualifications that every other project has to. So it's not just a blank check. It's something that I think each commissioner will have some freedom to do something, but I think sometimes we feel the pulse of our districts more immediately than the whole board. So it's just a thought to kind of help get some money out there a little quicker than we were seeing.
All right, is there a motion to approve?
So moved.
Is there a second?
Second.
All right, any questions or comments? Commissioner Friend?
Yeah, thank you, Madam Chair. I can honestly say over about the last week, and I don't think Commissioner Boyle is probably surprised by this. I can honestly say over about the last week, maybe week and a half, that I wasn't exactly sure how this would. Work. I can tell you that 2.5 million per district. I think what we're essentially doing, based on some of the research, what Commissioner Boyle, Commissioner Rogers, and Finance Director Joe Lorenz, some of the other conversations I had with the rest of the board members, it would occur to me that I think that it just provides a little bit more in-depth analysis. And an analysis and vetting, not earmarking. I mean, I know what an earmarked fund looks like. I've seen it. That's not what we're doing here. If that was the case, and if that was what we were doing, I would vote no in a New York minute. Now, I'm sure that I can get calls from all kinds of people in District 7 and get calls from people in Western Douglas County, and they say, hey, I heard you had $2.5 million. I raise my hand. I want that. Well, they're already in the hopper. They've already asked for it. I think the only concern I had after I understood all of this is, are we adding another layer of bureaucracy? My answer is probably no. To that, I think it's been cleared up in my mind. Like I said, I think it's analysis and vetting. The $17.5 million, the final point is, the $17.5 million is dependent on the steering committee doing some initial analysis and all 7 board members approving it. Commissioner Boyle's right. I don't have any problem with this resolution. Maybe a week and a half ago, I had a problem understanding, but I'm not there anymore. So, thank you, Madam Chair.
Thank you. Any other questions or comments? Commissioner Morgan?
Maybe I'm not as fast as Commissioner Friend on this. I have some of those reservations because my thought is it's still going back, and I had great respect for some of our meetings that the committees had. I'm not part of the steering committee with Commissioner Friend, Commissioner Chris Rogers, and Commissioner Borgeson, but certainly liked the way it was going. So my feeling is to abstain from voting on this. I'm just not sure if it does seem like another layer to me, because we're going to be trying to meet in our district, and I want to work with the other commissioners, Chris, you know, where there are needs. And if this does pass, that's what I plan to do, to work with the other commissioners and what they're doing. I respect greatly Commissioner Boyle bringing this forward if it can help expedite it, but I want to be sure. I think all of our districts overlap, and we all try to work on all the districts. So I will probably work to partner and be there. A couple of my priorities definitely are the mental health area and dyslexia as part of that, and what I hear from corrections and others on that issue. But that's where I am with it, because it's still going to go back to the full committee. And I think that could create a little bit of a turmoil, that somebody may have something, and why was it turned down? You gave me that $2.5 million, and I've got this priority. It does meet the criteria, and that's what I want to do in mine. And yet, could the committee then say, no, we're not going to do it, and then there's that disappointment. So I'll work hard to work with everyone on this matter. It passes for sure, and work with the funds if I was to get part of that. But I will abstain, and we are required to state our reason for abstaining, and that's what I've done here today, Madam Chairman.
Thank you. Any other questions or comments? There is a motion and a second. Please vote.
Motion passes, Commissioner Morgan abstaining, all other commissioners voting yes.
Next is a resolution reallocating relocating $410,000 in emergency rental assistance program funds from the COPE rental assistance program allotment to the Nebraska Volunteer Lawyers Assistant Project's eviction mediation assistance program. Commissioner Boyle, did you have any words you wanted to say about this one?
Yes. So the Emergency Rental Assistance Program was developed with the CARES Act money, or as separate from the CARES Act. But bottom line is that that money it can also be used to help tenants and negotiate or work with their landlords. And really, there's a volunteer program out there called the Nebraska Volunteer Lawyers Project, who are willing to help tenants navigate through the eviction process, and also navigate through applying for money for emergency rental assistance. So right now, as we speak, eviction court is happening right below us. This morning I walked down there before I came into the chambers here, and there's a lot of energy down there today, and I'm not sure that's necessarily a good thing, except that I know that there are some volunteer lawyers down there talking to folks to help them navigate the process. It's very moving when you're down there. You can see folks coming in and with papers in their hands, and there are people with babies in their arms, and it's very moving to see that. So this is a very important project. Be very clear, this is not taking funding that is from the American Rescue Plan Act. This is money that can be used. This has already been vetted, but this can be used even though it's not going directly to tenants for rental assistance and rent. It's helping people navigate that process. So this is the only other condition that the emergency rental assistance money can be used for. So I think it's very important that we get this funding there, especially since it's not really impacting our bottom line in any other way. The money is there. It's coming out of the COPE budget. COPE is the organization in Western Douglas County that was providing services to help people get rental assistance, and they've not been able to use all of their money. So this money is coming out of their allocation, and they're fine with it. They say that there's plenty there to use for this. So I think, number one, this is not affecting ARPA funds, so that means that financially, it's not a hit to us at all. And then number two, it's just the right thing to do to help folks who are being evicted and help landlords come to more reasonable conclusions and make that process not quite so difficult for everyone. So I would appreciate everyone's support and make the motion.
Second.
Okay, there's a motion by Commissioner Boyle, seconded by Commissioner Kavanaugh. Commissioner Kavanaugh?
Thank you. And I commend Commissioner Boyle for bringing this important measure to us. It is just the right thing to do. Winter's coming, and with the eviction moratorium that the federal government had imposed expiring, it's more important than ever to make sure that people have a roof over their heads. I am encouraged by my fellow attorneys who have volunteered to come forward and give their time and advice to help people. This should be something where, with the rental assistance monies that we have available and are offering to landlords, an opportunity for everybody to do the right thing and make sure that our community is safe and warm and housed for the winter. And this is a good step in that direction. So kudos to Commissioner Boyle and all those who worked on this. I think it's a very innovative and imaginative solution that meets a real need for people who need help. You just have to go downstairs and watch what's going on in the eviction courts to see that the people down there need representation, and this will provide that. So this is a great idea and just the right thing to do. Thank you.
Any other questions or comments? Larry?
Larry Storr, 5015 Lafayette, 68132. I am in favor of this, but I'd just like to point out that without a two-way debate, some appearances or maybe make things sound inappropriate. To me, this makes me sound like, gee, I want to get in line with my commissioner for some of that money.
That's not the item, Larry.
I'm
We're
sorry?
on the rental assistance.
Yes.
Okay.
I'm very fortunate. I'm not without a house right now. I might be very shortly with the rising property taxes, however. Is there anything in there for people that are losing their houses because of property taxes? Do we know how many landlords are actually know about this and actually getting help? Because there for quite a while, everybody was down on the landlords in Omaha. So why would all of a sudden we be wanting to help them when we were, I forget what they used to call it. I don't want to use that word. But this is like taking money from one and giving to the other. It starts out, I think, with federal dollars, which are still my tax dollars. But this is not really clearly understood because we don't have that open two-way debate. So I once again want to point out that maybe these things should be opened up for two-way question and answer debates. A debate implies two people, but it does not necessarily say conversation. It's not the same thing. Let's have more conversation. Thank you.
Thank you. Any other questions or comments? Commissioner Boyle?
Just one more thing. I think there's someone from the Volunteer Lawyers Project here that can speak to the program a little bit and answer some questions. I think I'd like to hear some like results. So come on down. Tell us what's been happening so far, just so people can have a familiarity with what you all are doing downstairs.
Thank you, Commissioner Boyle and Douglas County Commissioners, for giving me this opportunity to speak this morning. My name is Lori Hairdale. I'm the director of the Volunteer Lawyers Project at the Nebraska State Bar Association. So the Nebraska State Bar Association is a membership organization for Nebraska lawyers. And part of the goal of the Nebraska State Bar Association is not only helping lawyers help people, but it's to help us bridge this justice gap. And so the way we do that is through the Volunteer Lawyers Project. Our job at the Volunteer Lawyers Project is to basically manage and facilitate pro bono opportunities for lawyers to engage in to help low-income people with their civil legal issues. So the Tenant Assistance Project is one of the programs that we are facilitating. We started facilitating it in Lancaster County at the start of the pandemic. Really, that was about in April of 2020. We launched it here in Douglas County in August, so on August 2nd. So it's brand new here in Douglas County. It really started as an eviction diversion program or eviction defense program in Lancaster County, but it has since evolved. It's now really, the focus is more on homelessness prevention. And so here in Douglas County, we have about 20 organizations that are part of a collaborative. So the Tenant Assistance Project is a collaborative effort. It's not a standalone nonprofit organization, okay? And so there are about 20 organizations here in Douglas County working together to make that happen. And so we've got folks from homelessness prevention, so Eastern Nebraska Community Action Partnership, Heartland Family Services, Together, and others. We have folks who do the eviction defense work within the collaborative, so that is Legal Aid of Nebraska, and it's also our volunteer lawyers that we recruit to do that work. We have eviction diversion as an option, and so Concord Mediation Center is a part of this collaborative, offering a free mediation diversion program for landlords and tenants who maybe want to mediate to resolve their disputes rather than being in the courtroom. And then last but not least, we have the emergency rental assistance piece in place where we're working directly with Match and COPE and others who are distributing those rental assistance funds. And we have them on site with us every day to help us work with landlords and tenants to try to navigate that emergency rental assistance program and get those funds coming into the hands of landlords. So in Lancaster County, this has been going on for over a year now. We've helped more than 500 low-income tenants and families there. And in Lancaster County, we've gotten about $2.8 million of the emergency rental assistance in the hands of landlords as a direct result of the Tenant Assistance Project operating there. Here in Douglas County, it's still too new yet to know how much money of that emergency rental assistance getting into the hands of landlords is a direct result of the work we're doing. However, we've helped about 75 families and individuals now, low-income individuals with their eviction matters, resolving these cases. Most of these cases resolve with a stipulated agreement between the landlord and the tenant for either more time for the tenant to have to move out or more time for them to be able to pay and get caught up on their rent. So far, as you know, we had an eviction moratorium in place. In Lancaster County, more than 100 low-income tenants were helped through that eviction moratorium. And here in Douglas County, it was a very short stint, about 3 weeks after we had launched, that it was in place, and we helped about 20 families through that eviction moratorium with the CDC declaration. So far, lots of great results for both landlords and tenants. And so if anybody has any questions, I would sure love to answer them.
Yeah, I think that's the key point is that this is not just about tenants. This is also about landlords. It's getting them the funding that they need, getting the money that they deserve to, and really it's just making the situation, it sounds like, less adversarial and more of a team effort as opposed to resolving these issues. And so I think that to me is one reason to do it. Is it seems like it's a kind of a win-win And then it's a triple win because we are not paying for it out of ARPA money. It's money that wasn't going to be spent anyway. So it's a triple win, which is rare. But last but not least, the most important point to me is that we are addressing homelessness. I mean, women and children are benefiting from this program, and that's if we don't take care of those in our community who have the most need, then we're not doing our jobs. So I appreciate the work that you're doing, and I'm glad that we can work towards funding this.
Thank you very much, Commissioner Boyle. The other thing I did want to point out as well is we have met with the Apartment Association of Nebraska, and we have met with MOPOA, which is the Metropolitan Omaha Property Owners Association, to talk with them about ways that we can work together to help solve the homelessness issue, the homelessness crisis, particularly as Commissioner Kavanaugh brought up, we're coming on to winter. So
Thank you. Thank you very much. Commissioner Kavanaugh?
One second, please, if you would. And I appreciate that. I think, it's a collaborative effort, and we're trying to get the landlords paid as well as get people, to have adequate housing. So it's it's a two-sided coin here, and the resources that we're using allow the landlords to get paid. It's just the mechanics of keeping people in the homes until we can get the rent paid that we're really dealing with. And I don't know if you know, but my understanding is of the 410,000 in funds that we are designating here, the longevity of this program is more than just right now, or can you give us a scope of time that this would provide services for?
Absolutely. So with that money, we would support 2 full-time attorneys who would be facilitating the project, and as well as an administrative assistant who also does a lot of kind of the behind-the-scenes work. This money would take us probably out for 3 years.
3 years?
Yeah.
Very good. Thank you.
You're welcome. Any other questions?
No, Commissioner Friend, go ahead.
Thank you, Madam Chair. That's interesting. What would be the thought process? Thank you for the information, by the way. What would be the thought process in year 3? I mean, these problems don't go away, not just with COVID. How do you fund that stuff going down the road? What's the strategy?
That's a fantastic question, Commissioner. Actually, the way we got started was through local foundations, right? So there's a number of local foundations here in Omaha and of course in Lincoln that are very interested in this particular issue, and that's how we started. And so we are constantly fundraising, or have been anyway, through foundations and others who are willing to give.
Okay, thank you.
And that's the only comment I was going to make, is I want to be careful that we aren't setting up, again, a process that's going to be all of a sudden, it is going to be gone in due time. And we're not addressing, in my opinion, the long-term issues that need to be addressed with housing and homelessness. And this, to me, is just kind of a temporary fix, which I'm not saying is a bad thing. It's just, I don't want to give people false hope that it's going to be here forever, because the money's not going to be here forever. And so I think it would behoove us, if we're able to get all of the people we need to around the table to start talking about those longer term issues, which again, we all talk about, preventing homelessness, affordable housing, that we are able then to make progress in those areas so that we don't have to have this. So that's the only thing I want to make sure people still understand, because 3 years is really not a very long time. And then secondly, I do want to thank you for reaching out to the landlord associations folks. And I was actually the one who spearheaded that, because it felt wrong to me that we were setting up something that looked like it was kind of dogging landlords without getting their input. And it's been, from what I've heard, it's been a good conversation and a collaborative conversation. And so I thank you for that. And I know that there are still conversations going on. So I appreciate that.
Absolutely. Thank you, Commissioner. And yes, this collaborative will continue to evolve to bring more folks to the table so we can work on long-term solutions.
Great, great. Okay. Well, if we can help in any way, let us know.
Thank you. We appreciate it.
All right. With that, please vote.
Motion passes 5-0.
Our last ARPA funding is the approval of a resolution to transfer $2,165,041.83 of calculated lost county revenue from the ARPA fund account held by county administration to the county's general fund reserve. Again, this has been calculated, vetted through Deloitte. It is an appropriate and stated use of ARPA funds. And I would ask for a motion to approve. Commissioner Kavanaugh?
Yes, I'd just follow up with Joe, because we've had some ongoing discussions going back to the initial, I think, inquiry that I had relative to our lost revenue availability. And I think I pointed out at that time that there was at least $2 million in visitors improvement funds that was lost. And Joe, I know that you've researched this thoroughly, and this is it $1 million in lost revenues, is in that ballpark. Tell us how that calculation is arrived at, would you please?
Yeah, the calculation is a formula that was set out within the ARPA Act, and it encompasses the total county revenue loss. So there's a formula there. So while you're right, there was about a $2 million loss in tourism revenue, and there was also some shortfall in revenue from the health center, which had to cut back on admissions. But other receipts went up, like our property tax receipts is higher. So you have to take that all in aggregate and then use this formula, and that's what we went through working with Deloitte, and came back this so that in aggregate, the impact for this period was about 2.1 million. And then the law says that you can take that amount out of your ARPA funding and just put it into your general fund and use it with just a few restrictions. And the other thing to note is that this is just not a one-time calculation, but during the period of the ARPA Act, you're allowed to calculate this amount of lost revenue for every year. So going forward, we'll have the opportunity to do it again, but this is just the amount for the most recent period.
Thank you.
All right, any other questions or comments? I can't remember, was there a motion? Yeah. Okay.
Yes, there was.
All right, please vote.
Motion passes 5-0.
Next is the monthly report from the clerk's office as presented. Under committees, there's nothing other than the weekly personnel report from civil service as presented. No legislative issues at this time. We do have need for an executive session for litigation and legal advice. And union negotiation. Is there a motion to go into executive session? Motion by Commissioner Morgan, second by Commissioner Boyle. Please vote.
Motion passes 5-0.
Thank you.
It's somewhere. I make a motion to
Adjourn.
Everybody's voting yes.
Okay. Motion to adjourn passes, reconvene and adjourn passes, 4-0. We are adjourned at 10:53 a.m.